Steve, who is Shakeel Afridi and why is he in jail in Pakistan?
He's a doctor. He's a Pakistani doctor who was hired by the CIA to engage in a fake vaccine campaign in Abbottabad as the CIA in the spring of 2011, March, April 2011, were attempting to determine whether or not Osama bin Laden and his family members were living in that compound. They wanted to collect blood samples in order to do DNA checks to confirm whether or not this was true. So that's how he came into the picture. That's who he is. Osama bin Laden was killed May 2nd, 2011. He was arrested 3 weeks later. No one's seen him, as far as I know, since that time.
How important was that biological information to actually tracking bin Laden down?
Well, the campaign, the ruse that he was involved with, never was successful. So they didn't, at the end of the day, they didn't succeed in gathering the blood samples and using them definitively. So it was an effort that at the end of the day was not decisive. It was not materially decisive in the effort at determining whether or not Osama bin Laden was living in that compound.
So how do you see this, and what is the major significance of this event, series of events that have landed Afridi in jail now in Pakistan for 33 years?
Well, there's a couple of different layers to this. First of all, this was part of an extraordinary American effort to locate and capture and eventually kill Osama bin Laden. And so the use of this type of public health cover brings forward the question of what are the limits of tactics and instruments in pursuit of a target like Osama bin Laden. And in this case, choosing to use a public health cover had all sorts of very negative downstream impacts. It was alleged that Save the Children had been involved, the U.S. non-governmental organization which runs huge programs in Pakistan. It's alleged that they aided in the recruitment of Afridi and that their programs had been hugely disrupted in terms of delivery of medicine and other commodities to some 35,000 children, their ability to employ and put into the field skilled personnel and the like. So it's had some very grave consequences internally within Pakistan, and it's set off a huge debate, a global debate about the ethical boundaries for intelligence operations and where do you draw the line.
Are the revelations about Afridi's sham program a potential setback for vaccine programs?
They've already had significant detrimental impacts on the polio campaign. And keep in mind, the polio campaign, the global campaign to eradicate polio, which started in 1988, is nearing the successful conclusion. There are fewer than 1,000 cases in this last year. India, as of February, was verified as being clear of polio for a one-year period, and it's narrowed down to Pakistan, Afghanistan, and Nigeria as the three remaining endemic countries. Those all happen to be countries with large Muslim populations. Those are large countries that have problems of building up public trust and confidence in immunization programs, where all sorts of extraordinary measures have been taken to try to build the support by communities, by religious leaderships, by political leadership. And an event like this can really set all of those efforts back dramatically and can lead to a reinfection and recurrence and spread of a campaign that's a global campaign that is involving expenditure of $1 billion a year.
Should or could the United States have done more to protect Afridi in this instance?
I think the bigger question is whether the decision should have been taken in the first place to use a public health cover and hire local doctors to do that, because it compromised immunization programs that are highly sensitive and complicated. It wasn't materially important at the end of the day in the outcome. It placed Dr. Afridi in an extremely dangerous and compromised position Obviously, his life, his family's existence is greatly compromised and imperiled by all of this. It's not clear to me that the follow-on consequences and the sensitivities were thought through in any significant way. I think on the other side of this experience of Dr. Afridi, there will be a much different outlook and a much different approach. I think that this has been a very dramatic and powerful wake-up call to the sensitivities and the importance to be extremely cautious in using public health covers in complicated and sensitive intelligence operations.
Steve Morrison, thank you very much for your time.
Thank you, Andrew.